After months of testing on COVID-19 patients, the World Health Organization says it's ending trials of anti-malaria drug hydroxychloroquine, which President Trump touted and took himself as well. The UN agency also ending COVID-19 trials of a combo of HIV drugs, saying that they and hydroxychloroquine produced, quote, little or no reduction in the mortality of hospitalized COVID-19 patients when compared to standard care. Joining us now, family and emergency medicine doctor Janette Nesheiwat, a Fox News contributor as well. Dr. Nesheiwat, thanks so much for joining us here.
Hey, my pleasure.
Talking about hydroxychloroquine, it always seems like there's this aura of politics around it because the president himself acknowledged he took it, a 2-week course. The doctor there saying there was no harm that came of that. But it proved to be very controversial. The president criticized as possibly putting people who might take the drug as well in danger. Since then, there's been all sorts of reporting on this and studies into the drug. Now this latest from the World Health Organization. Your thoughts on their results?
Yeah, so initially, Molly, this was a new virus and we were desperate to try anything that could potentially save lives. And we had some initial anecdotal evidence that showed that this drug may have been therapeutic and may have helped to save lives in those who were severely ill and hospitalized on ventilators. So what the World Health Organization just did is they halted what's called the Solidarity trial. And again, this is a trial that included 3 different medications, not just hydroxychloroquine alone. It included 2 HIV medicines plus hydroxychloroquine. And what it showed was there was no significant reduction in mortality in those who were hospitalized and those who were really ill. It also did not show any increase in mortality, meaning this trial, these medications did not cause any harm to these patients who were hospitalized. And it also does not affect the potential study and use in the preventative use of this medication. So that's really important. But, like you said, there's so many studies out there, some that shows that it's helpful, some that show that it's harmful. The most recent study that just came out, published in the Journal of Infectious Diseases at the Hospital of Henry Ford in Michigan, showed that about 13% of 2,500 patients had a mortality reduction if they were put on hydroxychloroquine versus 26% mortality in those who were not on it. So, it's something that you have to talk to your doctor about. Again, there's still lots more studies that need to be conducted, but fortunately we have other medications and other therapeutics evolving, such as remdesivir, steroids, dexamethasone, and convalescent plasma is very important, as well as the vaccine that's under development right now, and then monoclonal antibodies are really important. So we've got a lot under development in the pipelines. This is just another study to show that, hey, it might work, and then of course we have all these other studies that show that it may not. So we have to weigh both ends.
I was reading that as well. The team at Henry Ford Health Systems out of Michigan, that study, 2,541 hospitalized patients. Of course, the goal in all of this is to not become hospitalized. Unfortunately, there are a number of states, Arizona, Florida, Texas, all seeing enormous spikes in numbers. Texas seeing some record-breaking cases. Florida also reporting record-breaking cases, particularly in Miami-Dade and Broward counties. Now public officials are basically pleading with the public to wear masks. But is that enough? Or does there need to be more of an effort to self-isolate? How do we turn back this tide that is so frightening there in the Sun Belt?
Yeah, so it's multifactorial. It's a combination of facial covering, physical distancing, keeping your hands washed and clean, avoiding large crowds. So the spread of this virus is propagated initially, I think, in Florida from opening of the bars and the restaurants and the close person-to-person interaction. And then, of course, the lack of compliance. But, the governors, they're taking action. They're scaling back. They're shutting down the bars and the restaurants temporarily. They've shut down the beaches to try to mitigate the, transmission of this virus. And then plus we have to remember there's a potential mutation in this virus, which makes it up to 10 times more transmissible. So perhaps Florida, Texas, Arizona, these states that have opened may be seeing an increase in the number of cases because of that potential mutation as well, not just the lack of compliance. So we really need to get on target and make sure that we encourage everyone, if you are unable to social distance, cover your face, because that's how this virus spreads from one person to another, by aerosolizing the virus. So we have the tools, we have the knowledge, we just got to adhere to it.
All right, Dr. Janette Nesheiwat, thank you so much for joining us today. We appreciate it.
Yeah.